Welcome to my channel. In this video we are going to see about muscles of arm. Muscles of anterior compartment of arm. It includes three muscles: biceps brachii, brachialis and coracobrachialis. Posterior compartment of arm includes triceps brachii. Anterior compartment includes biceps brachii, brachialis, coracobrachialis. Posterior compartment of arm includes triceps brachii. The nerve of anterior compartment of arm is musculocutaneous nerve. Musculocutaneous nerve mainly supplies the muscles of anterior compartment of arm. The nerve of posterior compartment of arm is radial nerve. The artery of anterior compartment of arm is brachial artery. The artery of posterior compartment of arm is profunda brachii artery. So the triceps is supplied by profunda brachii artery. Now let's see about biceps brachii. It arises by two heads from the scapula. It has long head and short head. Long head arises from supraglenoid tubercle of scapula. You can see the supraglenoid tubercle. It lies just above the glenoid cavity. Long head arises from supraglenoid tubercle. Short head arises from tip of coracoid process. You can see the coracoid process of scapula. The short head arises from tip of coracoid process of scapula along with coracobrachialis. Coracobrachialis also arises from tip of coracoid process. Both the heads fuse to form belly. The belly in the lower part of the arm forms thick tendon and bicipital aponeurosis. Insertion: it inserts through tendon and through bicipital aponeurosis. Tendon inserts on posterior part of radial tuberosity. You can see this is radial tuberosity. The tendon inserts on posterior part of radial tuberosity. Bicipital aponeurosis. It also inserts through bicipital aponeurosis. Bicipital aponeurosis extends on the medial side of the ulna and it merges with deep fascia of the forearm. It extends on the medial side of ulna and merges with deep fascia of the forearm. Nerve supply. It is supplied by musculocutaneous nerve. Action: supination of flexed elbow, flexion at elbow joint, strong action. It causes flexion at elbow joint. It also causes flexion at shoulder joint. It has weak action at the shoulder joint. Clinical testing. Biceps brachii is tested by asking the patient to flex the elbow against resistance when the forearm is supinated. First, ask the patient to supinate the forearm and then ask the patient to flex the elbow against the resistance. In this act, the muscle forms prominent bulge on the front of the arm. In this act, muscle forms bulge on the front of the arm. First, ask the patient to supinate the forearm, then ask the patient to flex the elbow against the resistance. The muscle forms prominent bulge on the front of the arm. Now let's see about coracobrachialis. It arises from tip of coracoid process of scapula. It arises from tip of coracoid process of scapula along with short head of biceps brachii. Insertion: it inserts into middle of medial border of shaft of the humerus. You can see it is medial border of shaft of humerus. It inserts into middle of medial border of shaft of humerus. Nerve supply. It is supplied by musculocutaneous nerve. Action: it is weak flexor and adductor of the arm. Weak flexor and adductor of the arm. Now let's see about brachialis. It arises from lower half of anterior surface of shaft of humerus. You can see this is humerus. It arises from lower half of anterior surface of shaft of humerus. Insertion: it inserts onto anterior surface of coronoid process of ulna. Anterior surface of coronoid process of ulna. Nerve supply. Medial two-third is supplied by musculocutaneous nerve. Lateral one-third by radial nerve. Action: strong flexor of elbow joint. It is often called Workhorse of the elbow joint. It is strong flexor of the elbow joint. If you observe these diagrams, you can see that in the upper part there is coracobrachialis, in the lower part there is brachialis, and the biceps brachii is present throughout the arm. Biceps brachii arises from the scapula. Coracobrachialis also arises from the scapula. Brachialis arises from humerus. Insertion: one inserts on the humerus, one inserts on radius, one inserts on ulna. Coracobrachialis inserts on humerus, biceps brachii inserts on radius, brachialis inserts on ulna. Now let's see about triceps brachii. Triceps brachii. It has three heads: long head, lateral head, and medial head. Long head. It arises from infraglenoid tubercle of scapula. Infraglenoid tubercle of scapula. This is glenoid cavity. Just below the glenoid cavity, there is infraglenoid tubercle. Long head arises from infraglenoid tubercle of scapula. Lateral head. It arises from oblique ridge on posterior aspect of humerus. It arises from oblique ridge on the posterior aspect of humerus. Origin of medial head. It arises from posterior surface of humerus below the radial groove. Posterior surface of humerus below the radial groove. Long head from infraglenoid tubercle. Lateral head from oblique ridge on the posterior aspect of the humerus. Medial head from the posterior surface of humerus below the radial groove. Both the lateral head and medial head arises from posterior surface of humerus. Lateral head from the oblique ridge on the posterior aspect of humerus. Medial head from posterior surface of humerus below the radial groove. Insertion: posterior part of superior surface of olecranon process. It inserts on superior surface of olecranon process. Posterior part. Posterior part of superior surface of olecranon process of the ulna. Now supply radial nerve. Action: powerful extension of elbow joint. Powerful extension of elbow joint. Long head supports the head of humerus during hyperabduction of the arm. Long head supports the head of the humerus during hyperabduction of the arm.